Are we good? Okay. Hi, we're going to do the Subcu Palliative Infusion walkthrough. So a lot of people have asked if we've ever done one of these. No, we haven't. We've had it for about 2 years. But it's always a good idea, since it's something we don't do that often, just to review it really quick, of what different things you'll need, where the supplies are located, how the pump works. So that's what we're going to do today. So if you ever have a Subcu Palliative Infusion ordered, things that you are going to need are the pump, which looks like so. Our pump on 3 West is located by the charge nurses station. It's in the top drawer. And the pump for CCU is out of order right now. It is out somewhere being repaired. I'm not sure where. I don't know when it's coming back. But I'm following up on it. So in the event that CCU needs one of these pumps, you guys can always come up and use ours. And then if things, get really wild and we have 2 Subcu infusions going at the same time, 3 West, we can always go grab from Family Birthplace, because they use these for epidurals. So we'll make it work one way or another, but that is where we have one pump. It'll be up here. So you need that. You'll also need the cassette, which is what's going to have your medication in it. Likely this is going to come from pharmacy, and it would have a patient label on it. So you would need to go pick that up. And then you are going to need the needle tubing, which looks like so. And it comes in a little package that has a dressing. We have 2 size needles. We have a 6mm and a 9mm. So your 6mm is for your smaller patients. 9mm would be for the larger patients. And then you would also need the CAD extension set that comes in a package that looks like this. And the tubing looks like so. Now, where the tubing is located, so for 3 West, the needles and the tubing are located on the cart. It is in the same cart as the PCA tubing. So when you pull the drawer out, the PCA tubing's in the front, and then in the last 3 slots, it's the 6mm, the 9mm, and the extension set. For CCU, where this is located, you guys have one of each. So you have 1 6, 1 9, 1 extension set. It is in the D storeroom, I believe in drawer 9. Is that right?
I don't know off the top of my head.
Okay.
But I will put that with this email.
It says Subcu Palliative Infusion on the label for the drawer, so they are in there. I did double check, so I visualized them. So that's where everything's located. The other thing that you are going to need in order to make all this work is you'll need the key, the CAD key. So looks like so. It says CAD on it, so it's pretty distinct. It's a different looking key. Your key, both keys for 3 West and CCU should also have little jingle bells on them, so they make noise when you grab them. And then you will also need a code to use the pump, and the code is on a yellow piece of paper taped to the inside of the med drawer in each med select. So that's where everything is. So to hook everything up, what you do first is you want to get your your extension tubing, and there's a blue port and there's a purple. So can you get a good zoom in of that? Okay. So for your purple port, what you want to do with that one is you want to attach that to your needle. So purple goes toward the person. So if you think purple people, that goes there. And then your blue connects to the cassette. There's only one right way to attach this, and this is the correct way. If you forget and you put the purple to the cassette and the blue to the person, when you try and prime it, it's going to tell you it won't. So that'll kind of be your clue that you mix the colors up. So once you have all that put together, then you can go ahead and put your cassette and attach it to the pump. And so the way that you do that is on this pump, you have a little lever here. So you pull that down, and then on your cassette, there are these 2 little plastic hooks here. And so these hooks are going to go inside these metal rods right here on the bottom of the pump. So it's hard to get a good picture of this on camera, but they just slide in there, and then it's like a little move. You push until you hear it click, you close the lever, and then you take your CAD key, and your key goes in right here, and then you just put your key in and then lock it in place, and it'll show you on here which way to turn it to lock and unlock. So It's pretty easy. So once you have it all locked in place, then you can go ahead and turn your pump on. Before I turn it on, one thing you guys should know, there is connection in all the setup here for you to be able to plug this into the wall. So it makes it a lot easier, but this is also can be powered by 4 AA batteries. It just goes in the top. So if you ever needed to go on a road trip or something like that where it couldn't stay plugged into the wall, it will run off battery power. The other thing too, and I'll show you the screen when we turn it on, but if for some reason it's not plugged into the wall and you run out of battery power, when you put new batteries in and you turn it back on, the first question it asks you is, do you want to start a new patient? If you say no, it goes back to the old settings, so you don't lose anything, which is really nice. So anyway, we'll go ahead and turn it on. So your power button's over here, and it takes a few seconds to turn on. You get a good picture on camera of that? Okay. So first question is, do you want to start a new patient? So for our purposes, we're going to say yes. Can you guys see it okay? All right. So your next question it's going to ask you is what kind of therapy you want to use. So the therapy you guys are going to select is the sub-Q therapy, and you'll just hit select. The next question it's going to ask you is what kind of concentration. So is this a standard, a high, or non-opioid? So I'm just going to go ahead and stay with the standard concentration. And then the third question it's going to ask you is what kind of medication. So it lists off different ones there. I'm just going to stay with the first one, which I think is morphine. So we'll just keep with that. And then I think the next screen is asking you for the code. So the code, like I said, is on the yellow piece of paper inside the med key drawer in the med select, and the code to it is 815. Did it work?
Mm-hmm.
Yay. All right. And then it's asking you, is everything correct so far? So it's just having you confirm the settings you've put in so far are correct, so we can say yes. And then this is where it's going to have you actually start putting in the pump settings, the specific settings to it. So then you would just hit review, and then it's going to take you where you can put in the continuous rate, the PCA rate, the lockout, and the reservoir volume. The reservoir volume is how much is in the cassette that you got, okay? Typically, I think it's defaulted to 50, so that should be what yours is. So the way to change everything is you just scroll down and you pick the thing that you want to edit. So I should be on continuous rate right now. So if you just hit select, it'll then take you to a screen where you can just dial up or dial down your rate that you want. And then once you've selected that, you just hit save and it'll program it for you. And then it'll take you back to the main screen and you can go down to the next and keep editing and until you've got all your orders the way that you want them. Once you've done all that, that's when you want to get your second person to come in the room and double check what you've put in the pump is correct. And so what they are going to do is they are going to hit this accept value button, and when they hit that, it puts a green check mark next to each value showing that they're approving that they've checked and it matches the order. Once they've checked everything, then it will give you an option to go to the next screen, and it's going to ask you if you want to go ahead and start priming the pump. So we're going to go ahead and say yes. And then here it's just reminding you to make sure it's disconnected from the patient and that you don't have it clamped or anything. And then you can go ahead and you can prime it. So one thing about this pump is it doesn't auto prime like the kangaroo pumps. It doesn't know when to stop. So you have to watch it. Where's my needle? You're going to have to watch it until the medicine starts coming out of the needle. And once you start seeing that it's coming out of the needle, then you can come over here and you can hit the button that says stop priming. When you do that, it'll show how much you've primed on the screen, and it'll ask you if you want to continue priming. So I'm going to say no, I don't want to continue priming. And then it's going to ask you if you want to start the pump. So when it gets to this part on the pump, what you want to do then is you want to go to your patient and you want to pick a site to insert your needle into. So ideal sites would be the arm, the stomach, the thigh, or the back. Sites that you don't want to use would be the breast tissue, any bruised tissue, or any infected area. You just want a good, clean, healthy site. So when you've picked that area, you just clean it real good. You get your needle ready. And then you just insert the needle, lay the little wings down, and then you would get your dressing in your package here, put it over top, initial and date, and then you're good to go and you can start the pump. The needle and all the tubing is good for 7 days, unless maybe the needle comes out accidentally, or if you notice irritation or infection starting to form at the site, then you would need to remove the needle. You would need to change out the needle and the tubing, put new on, select a new site that's at least 2 inches away from the previous site, and then you just would reinsert and restart the pump. If, say for example, your patient has passed away or they're getting discharged or something like that, and you're finished with the pump, it's really easy, like I showed you, to remove the needle. You just remove it out, and then the 2 little wings come down, and they kind of feel like Velcro. They Velcro around the needle. And then to waste the medication in the cassette, what you would do is you would just come over here and unlock the pump again. Pull your lever down, and it'll pop the cassette out. You'll disconnect it from the tubing. You would put a syringe here. And then important thing is you have to press down this little spring here, because that's what opens up the cassette for you to be able to pull medicine out. So you'd have to push this down and then pull the medicine out with a syringe. Once you empty the cassette can go in the sharps container, and then you can waste the medication in the sink with, whoever your witness is. And if this cassette came from pharmacy, then you would need to fill out the pharmacy waste paper, and you'd send that back to pharmacy, and they would take care of the rest of it. The other thing that I've been showing people is how to clear the pump. Same with PCAs, the pump would need to be cleared every 4 hours. And the way you would do that is on the main screen here, there's a reports button. So if you hit that report button, the first option it gives you is given in PCA dose counters. So if you select that, it will actually show you the volume and the amount that has been infused, and it'll show you the PCAs, injections that have been given, if that's how you set up the pump. So what you would do is you would just look at those values, you would put that in your PCA flow sheet, and then there's a button down here that says clear given, and it will clear your amounts, and it will actually also reset the date and the time, so you know when it was last cleared when you're looking at your values. The date and time is messed up on this pump. I don't know why. I need to get it fixed, but in an ideal situation, the date and the time would be correct. But that's all really that I had to share. So if you have any questions, feel free to ask your educator. We're always happy to help.